Today I am going to show you how to dissect the fetal pig, and it is important to remember that a good dissection should reveal all of the organs clearly enough so that another person could examine the specimen and see the essential relationships of the organs and their connections with other organs without difficulty. You don't want to remove anything. Before we begin the dissection, you must learn to distinguish a male pig from a female pig. In this particular case, our different sexed pigs have different colors. The male pig in this case is pink, and this structure is the preputial orifice, the opening into his penis. The pig is lying on his back, and his feet are coming out towards you. This penis lies right under the umbilical cord. You will not find this opening under the umbilical cord of a female. The male here is lying on his back with his tail down and his feet sticking up. This opening is his anus. Ventral to the anus is a sac, which in this case is empty. This is a scrotal sac into which the testes descend during the development of the male pig. In this pig, the testes have not yet descended, so the skin is loose. This is the female pig, and you can see that under her tail she also has the opening to the anus. But ventral to the anus, there is another opening in this structure, the genital papilla, which is not seen on the male. You see there are two openings, the anus and the opening into the genital papilla. The female lacks a scrotal sac, and so there's no loose tissue on either side of the genital papilla. This is a diagram of the face of the pig with the skin dissected away to reveal the glands and the muscle of the face. The diagram is somewhat misleading with respect to the parotid gland. The diagram indicates that it is a triangular gland easily distinguished when you dissect away the skin. You will see in the dissection that it's not nearly so clear as indicated. Deep to the parotid gland is the mandibular gland, which is much easier to see in your preparation. In addition to these two glands, you should learn to recognize the masseter muscle, the main muscle of the jaw. Underneath the masseter muscle is the parotid duct, which carries the saliva out to the mouth. Here you see the pig lying on its side, and you want to cut very, very carefully into the skin, not cutting too deeply, and carefully teasing the skin, pulling it backward away from the muscle. It is best to use a dull probe and do more teasing than cutting. Notice how thin the skin is. Now we have revealed the muscle and the glands. You'll notice there isn't much color difference between this gland, which is the parotid gland, and the skin which overlays it. Notice it's not nearly so clear a structure as the diagram indicated, but this is the parotid gland. Much clearer is the mandibular gland, outlined here, and we have pulled the parotid away from it to expose it more clearly to your view. These two glands are different from the masseter muscle here being encircled in their texture. And this is the parotid duct, which lies underneath the masseter muscle. In order to dissect to see the structures behind the mouth, You should follow the curvature of the mouth with a pair of scissors and cut posteriorly, following the curvature, gently opening the mouth. Here you can see that on the roof of the mouth is a hard, bony structure, the hard palate. It is underlain by bone and cartilage. Posterior to it is the fleshy, soft palate. And on the tongue you see little papillae along the edge. Now you want to continue your dissection caudally to this structure, which is the epiglottis overlying the voice box or larynx. You see the opening, the glottis, and the flap-like structure over it. This box is the larynx. Here's another view of the larynx, showing that extending from it is the trachea. The trachea has ring-like cartilages which hold it open. You can see them here. Behind the trachea is the esophagus, a thin, muscular tube which extends from the mouth to the stomach. There is an opening out of the mouth into the esophagus, and you'll notice the esophagus is collapsed because the fetus does not eat. To get a better view of the voice box, you will want to turn the pig on his back and dissect anteriorly towards the chin. And pull the skin aside, revealing the underlying structures. Here is the larynx or voice box from the ventral view. The larynx continues posteriorly to the trachea, and the trachea will lead to the lungs. Behind the trachea is the esophagus. Lying ventral to the trachea is the thyroid gland, and beside it, the thymus gland. This white gland is the thymus gland. The thymus lies on either side of the trachea, but has been dissected here so that you could see the esophagus. The thymus extends down over the heart a little ways. You can see a piece of it here. And it's quite a large gland in the fetus. Now we continue our cut from the neck posteriorly down through the sternum and pull apart the ribs of the thorax. Now you can see here that inside the thorax is the heart. Now this is the larynx and the vessels of the neck. And moving caudally, you see as we enter the thorax the pericardial sac over the heart. And behind and beside the heart is the lung. Here's some more lobes of the lung. This structure is the diaphragm, a muscle which separates the structures of the thorax from the abdomen. It goes clear across the body. This is the liver. Now we're going to compare the diagram in your handout, shown on the left, to the structures in the pig, shown on your right. This is the liver, which you have just seen, lifted up to expose the structures lying underneath it. If you will pull the lobes of the liver apart, you'll see a little fragment of a vessel, the umbilical vein, between the lobes of the liver. You had to cut the umbilical vein to get into the abdomen. Under the liver is the gallbladder, little sac. This structure is the spleen. Between the spleen and the liver is the stomach. Now if you lift the stomach, all the tubular material in here is the small intestine. Quite a bit of small intestine. And the coiled structure here on top are the coils of the colon, or large intestine. If you follow this tube you will come to the descending part of the colon, which goes down the back of the pig and extends out between the legs to the rectum and finally exits through the anus. This structure has been reflected away. It is the bladder connected to the umbilical cord. In this same area, you will see the kidney against the body wall. This is the kidney. Another structure visible in this area lies right at the base of the stomach, and that's the pancreas, sort of a mealy gland that lies right along the base of the stomach and down the edge of the small intestine. Now this is a closer view showing the liver, sort of eaten away by our manipulations. There is the umbilical vein. You can see the opening into the vein. As we lift the liver, we see embedded in it the gallbladder, this little sac-like structure. The liver has been broken up a bit by our movements. This flat sac is the stomach. The stomach empties through the pyloric sphincter into the small intestine. And lying under the stomach is the pancreas. This is the pancreas here. It's being lifted. The pancreas extends across under the stomach and down the entrance of the small intestine. This is a close-up view of the spleen. Notice it's different color from the pancreas. If we lift the stomach and spleen out of the way, we can follow the small intestine through its maze of coils. If you follow the small intestine posteriorly, you see that it comes to join the large intestine or coils of the colon. And where the small intestine crosses over here to enter into the coils of the colon, there is a blind sac called the cecum. Then as we move the coils of the colon and the small intestine out of our way, we can see that the colon continues posteriorly as a descending colon. Goes down the back of the body, between the legs, as the rectum, and finally exits through the anus. If we come back up the body wall, we see the kidney. This has been dissected away from the wall. Now if we move the intestines out of our way, we can see how the kidney looks when you first dissect this area. There is a membrane lying over the kidney. You can see it here. This membrane has been removed on the other side where you could see the kidney loose. This tube, which leaves the kidney, is the ureter, and it carries urine from the kidney to the bladder, which is connected to the body wall. This is a different view of that same kidney, so that you might see the ureter a little clearer as it exits the kidney and travels to the base of the bladder. The bladder is now to our left. This is the bladder. The two vessels are the umbilical arteries, and they've been filled with pink latex. Now as we move to the neck region and focus here in the neck region on the vessels with the head to our left, we will see that beside the trachea is the common carotid artery. There's one on either side of the trachea. Lateral to the artery is the internal jugular vein and the external jugular vein. Internal jugular and the external jugular join to form the brachiocephalic vein. There are two brachiocephalic veins, the right one and the left one. Another vessel joins the jugulars to form the brachiocephalic vein, and this is the subclavian vein, which comes from the shoulder. The two brachiocephalic veins empty into the cranial vena cava, which empties into the heart. This is a diagram of these blood vessels showing the common carotid artery beside the trachea, and the internal jugular vein lateral to the carotid artery, the external jugular vein lateral to the internal jugular vein, and you can see how the two veins come together to form brachiocephalic vein. The two brachiocephalic veins join to empty into the cranial vena cava, which goes to the heart. In the next diagram, the veins have been removed to clearly reveal the underlying arteries. Here you can see the common carotid artery, one on either side of the trachea, have arisen from a common trunk coming out of the heart. This is the brachiocephalic trunk. It arises from the arch of the aorta. These vessels are the left coronary artery and vein, which separate the two ventricles of the heart, the right ventricle from the left ventricle. Coming out of the aortic arch are the brachiocephalic trunk and the left subclavian artery. This is slightly different than it is in humans. Here there are only two vessels in the pig that arise from the arch, the brachiocephalic trunk and the left subclavian artery. This is the arch of the aorta, which comes out of the left ventricle. In our dissection, the head of the pig is to the right. The veins have not been dissected away, but here you can see the common carotid artery. This artery and one on the other side like it arise from the brachiocephalic trunk. The brachiocephalic trunk here you can see is underneath the cranial vena cava and arises from the arch of the aorta, which passes dorsally towards the back of the pig. Beside the brachiocephalic trunk is the left subclavian artery, which you can trace anteriorly over the ribs and out into the arm. This is the subclavian artery. Adjacent to the arch of the aorta is the pulmonary trunk, which comes from the right ventricle. You can see that the pulmonary trunk joins the aorta, which is not true in an adult pig and is only seen in a fetal pig. Now we're going to pass caudally with the dorsal aorta, which extends the full length of the body, and observe the vessels which are associated with it. This is a close-up view at the region of the lung. If we lift the lung, we find that the arch of the aorta gives rise to the dorsal aorta along the back of the rib cage. We follow it caudally towards the diaphragm, and we see that vessels leave the aorta to the ribs. This blue vessel drains the ribs and is called the left azygous vein. It has been cut, but in the normal circumstances it would extend into the heart. Now we pass posteriorly through the diaphragm, and the first artery which comes off the dorsal aorta is the celiac artery. It's It's the first artery off the dorsal aorta after we come through the diaphragm muscle. The celiac artery sends branches to the stomach, to the spleen, and to the pancreas. This is just one part of the pancreas. The second vessel off the dorsal aorta is called the cranial mesenteric artery, and it carries blood out to the intestines. When you look at the intestines, you will see that they are richly supplied with blood vessels. As we follow the dorsal aorta further caudally, a large vein that comes off the dorsal aorta is the renal artery going to the kidney. You can see both the renal artery and the renal vein at this level. Continuing posteriorly, we come to a vessel which is called the caudal mesenteric artery. Here it appears blue, but it should be filled with pink latex, for it is an artery that supplies the descending colon. The next vessel coming off the dorsal aorta is the external iliac artery, and it continues down into the leg, where it splits in two and gives rise to the femoral artery going to the outside of the leg, and the deep femoral artery passing medially to the center of the leg. Another vessel in this area is the umbilical artery, which we have seen previously. There are two umbilical arteries coming off the dorsal aorta, and they lie on either side of the bladder. Coming off the umbilical artery is the small internal iliac artery, shown here. Finally, if we lift this internal iliac and pull the umbilical artery out of the way, we can see a tiny artery that extends from the dorsal aorta posteriorly down the back of the pig. In order to see it clearly, we have to move the pig. Now in this view, this is the umbilical artery, and you can see the internal iliac coming off it. And now we can see the median sacral artery, which passes from the end of the dorsal aorta down the wall of the back into the tail. This is a diagram from your handout of the reproductive organs of the male pig. This is his urinary bladder, which has the umbilical arteries on either side, as you have seen in the dissection. This is the ureter, which comes from the kidney and brings urine to the bladder. The small tube extending from the bladder is the urethra, and it carries urine. This is the ductus deferens. There are two of them, one on either side, that bring material into the urethra. These two glands are the seminal vesicles. They have to be dissected apart to see the small underlying gland, the prostate gland. These glands add fluid to the ejaculate during copulation. The ejaculate moves through the urethra, as does urine, and is joined by the bulbourethral gland, which add fluid to the ejaculate. The urethra, at the level of the bulbourethral gland, passes through the bulbo-cavernous muscle of the penis. And after it passes through this muscle, it is now called the penis. In our dissection, we're at the level of the urinary bladder, and if we pass down the urinary bladder, posteriorly it empties into the urethra, which carries the urine outward. This is a a bulbourethral gland, one on either side of the urethra. The urethra comes to the body wall, and on the other side, the penis, which lies in the skin of the body wall, has been dissected out. This is the penis of the male pig. If we follow the urethra anteriorly to where it comes into the bladder, we see the ureter entry. At this level, we can see a tiny gland. These are the seminal vesicles, which have been dissected apart to show that there are two of them. And between them, there is a tiny amount of tissue which forms the prostate. It may not be visible in your pig. At this area, where the seminal vesicles and the prostate are located, there is a tiny tube, which is the ductus deferens, that comes from an opening in the body wall. This opening is called the inguinal canal, and through it pass the ductus deferens and the testicular artery and vein, shown here. Now we're looking at the exterior of the male pig, and his scrotal sac has been cut open to reveal the area of the testis. This is the edge of the scrotal sac. Here we can see the penis, the testis of the male pig, and this is the epididymis, in which the sperm from the testis are stored until the time for their ejaculation. The epididymis continues into the ductus deferens, a tube which we saw inside the abdomen of the male pig. Extending from the epididymis is a structure called the gubernaculum, which attaches to the scrotal sac and aids in the descension of the testis into the scrotum. This is a diagram of the female reproductive system, and here is the ovary. There's one on either side inside the abdomen of the female. Right adjacent to the ovary is a very tiny tube, the uterine tube, which is analogous to the fallopian tube in a human female. This larger tube is a uterine horn and should not be confused with the fallopian tube. It is here that little piglets develop. The two uterine horns join to form the body of the uterus. In a pig, the cervix and the vagina are adjacent to the urethra, which is here, and the urethra and vagina join to form a common tube, the vaginal vestibule. Behind the vaginal vestibule lies the rectum. Now, if we look in the area of the reproductive organs of the female pig, we will see the tiny pea-shaped ovaries. Here is one here, shown close up. And here's the other one on the opposite side of the body. You'll see that the ovary is very close to the tip of the kidney, and the ureter passes dorsally to the ovary. This tube is the uterine horn where the little pigs will develop. The two horns join to form the body of the uterus. See, it's flat here. The body of the uterus is entered by the cervix, which we have dissected open here to reveal that internally it is banded with muscle, which makes it look lumpy. Beneath the cervix is the vagina, which has also been dissected open to reveal its smooth interior. The vagina and the urethra, which comes from the bladder, join in a female pig to form the common tube, the vaginal vestibule. And behind the end of the vestibule is the genital papilla, which we have seen before. Posterior to the vaginal vestibule is the rectum of the female pig. This is the end of our dissection. This completes the dissection of the fetal pig.